Hi everyone, today I want to talk to you about orthodontics. It's a ever-growing popular area of dentistry, and a lot of people are now looking at how they can improve their smile with the straightening, with the whitening, with the bonding, all of those wonderful things. And then some people are falling for the online advertisements, the television adverts and things for these companies that are claiming that you don't even need to see a dentist. You can just take your own models, send them off, they send you some aligners in the post, you wear them, and it gives you these beautiful results in 6 months. It's a lot of money to invest in these as well, and if I was doing it, as I was recommending it to anybody, I wouldn't do anything unless I'd seen a dentist. There's something in dentistry called the daughter test. And this is what I base everything that I talk about and all the recommendations I make to patients on. So everyone else that knows me knows I've also got a master's in ethics, or dental law and ethics, and I find it a fascinating area, but I find it's really important because I would never recommend to anybody, and I would never do to anybody, something that I wouldn't do to myself, or I wouldn't do to my mum, I wouldn't do to my dad, I wouldn't do to my best friends, I wouldn't even do to my worst enemy, and I definitely wouldn't do it to my brother. So this is where it comes to the daughter test. You know, you wouldn't do it to your daughter. Now I like to apply that outside the box to friends and family as well. If I wouldn't do it to them, I wouldn't do it to you. And the problem with some of these orthodontic programs or things is that you've not seen a dentist, you've not had the baseline screenings. Orthodontics is not appropriate for everybody. And what is actually achievable for people isn't necessarily the same either. If you've got very bad crowding, these aligners are not likely to be able to rectify that. They can do some minor changes, and often you also need to make space from somewhere. So that may be doing a little bit of tooth surface removal from the teeth that you've got. It may be extracting teeth. But even then, you still have got to have the foundations in really good condition to be able to do that without causing any further detriment to the teeth. So you need to make sure there's no gum disease, no active gum disease. You need to check the bone levels. You need to check what teeth are present. You need to check there's no decay. There are so many things that need to be put in place first, making sure you've got great oral health before you even start doing any of the cosmetic or aesthetic work. As a profession, I can promise you, we all get very excited doing cosmetic and aesthetic work. We love it. We love being able to see improvements in people's smile. But what we don't like seeing is when people have come in because they bought this system, they've never had it checked properly, or they've seen a dentist once and they were just said, oh, off you go. And they've sent these aligners in the post, and then they come in and they've got loose teeth because they had gum disease that wasn't diagnosed beforehand. Or they've got other problems because things are only safe if you do all the background checks and if you get everything in place beforehand. They're not safe if you just rush in and you haven't checked. So again, if you're considering anything to do with straightening teeth, either talk to an orthodontist. There are some great orthodontists around, or talk to your general practitioner or general dentist, because a lot of them have got the skills to do things too. Just be safe, keep your teeth, keep your health, and then everybody will be able to smile. Take care, everyone.